Hello students, we will discuss a clinical test in the abdomen. Of course, currently it is of academic interest, but it is a interesting thing. That's why I'm just discussing, even though how far relevant in current situation. So what this clinical test is, look at that. There is a mass here. Ruler is placed here. So why this ruler is placed? What is this test called as? So this test is called as Blaxland ruler test. Maybe asked in academic thing, maybe asked in MCQs, Viva and so on. Because currently, what exactly to do is a flat ruler is placed on the lower abdomen, just above the level of the anterior superior iliac spines, and press properly, adequately. If the patient is having ovarian cyst in females, suppose, there will be aortic pulsation will be transmitted. If it is ascites, such a pulsation will not be there. So this is initially long ago told by Blaxland, and popularly called as Blaxland ruler test. Of course, currently whether it is ascites or ovarian cyst can be very well differentiated by ultrasound, CT scan, all imaging. So it's only of a clinical interest to improve or increase your academic knowledge, probably historical. So this is see that ruler test. So this is Blaxland ruler test. So here the patient had a ovarian mass here, and after opening we can see the ovarian tumor here. So this is typical of what is called as Blaxland ruler test. If the academic interest may be asked in MCQs. So how to all these photos, how to do Blaxland ruler test and other things are there in my SRB clinical methods in surgery, and detail about differential diagnosis of mass abdomen is there in my manual in detail, and operative surgery shows how to do different surgeries, everything in detail, and my DigiNow lecture through JP gives all lectures including specialties, operative surgery and instrument specimens and so on, so that you can purchase and per year and have the clear idea about entire surgery subject for Fijis and Gs as well. So students, I hope this clinical test, Blaxland ruler test, you have understood very clearly, which is of very much academic interest. Thank you very much.